addresses our youngest generations. She is doing research and work to bring physical activity into the classrooms and families, helping children regulate emotions and building lifelong habits. Dr. Rebecca Hasson is an associate professor at the University of Michigan's School of Kinesiology and director of the Childhood Disparities Research Lab. Her work focuses on improving child and family health through physical activity with the mission to get communities moving. So she will be presenting an important topic, enhancing mood through movement, the role of physical activity in youth emotion regulation. So please let us welcome Dr. Rebecca Hasson.
Good morning, everyone, and thank you so much for the invitation to speak, to share some of the work that my students and I have been doing over the past few years to get kids moving. My name again is Rebecca Hasson, and I am the director of the Childhood Disparities Research Laboratory, where we develop and design and evaluate physical activity programs to improve student learning, but most importantly for this conference, improve emotional well-being, as well as promote daily movement throughout the day. We work with teachers, families, communities all across the state to get their input to make sure that we can integrate physical activity anywhere at any time. And we predominantly use the evidence-based strategy of promoting and integrating exercise snacks into classrooms, bedrooms, homes, anywhere. So some of you may not be familiar with what an exercise snack is. Well, here it is. One teacher described an exercise snack as like a fun little Snickers bar. Instead of eating a king-size candy bar, it's just a little snack of exercise. It's just a little 1 minute, 2 minute, 5 minutes of exercise. This is great. You can see on the right-hand side of the slide, this is a review that recently came out that showed even just 1 minute. This is in adults just running up the stairs, parking farther away. Those do actually have cardiometabolic benefits that improve cardiometabolic fitness, improve glucose metabolism, and a whole slew of physical health benefits. We love exercise snacks because they perfectly align with children's natural movements. If any of you have kids or have been around kids, you know that kids move in these short, energetic bursts. They need to go to the restroom for whatever reason, they sprint to the bathroom. They need some water, they sprint to go get some water. And so these exercise snacks are a great way to promote physical activity in our younger generations. But I will also say that physical activity snacks, exercise snacks, are great for us as adults because you can think, as we heard previously, the motivation to get out there and exercise for 30 minutes, 60 minutes, that might work for some who run marathons, but for others, they might need just these little small pockets of time to engage in physical activity. And we're really interested in understanding what are the benefits that come from those small bursts. So why do we use these particularly for the classroom? Well, we know since the pandemic, child behavior has plummeted, and it is not of their fault. It is based on the social conditions that they were in during the pandemic that has led to increases in student misconduct, rowdiness, acts of disrespect to the staff and teachers. And so as we work with teachers across the state of Michigan, they ask us, how can you help us in terms of improving student behavior? They're no longer talking about academic outcomes. They're asking, can you get Johnny and Sally to just sit in their seat so they can at least listen to the teaching? And then we can start talking about learning. And this is true even 5 years after the pandemic. So our students are still recovering and teachers are looking for different avenues to do that. So we ask questions like, how do we understand emotions? How do we understand feelings to better understand how do we manage these behaviors that we're seeing in the classroom? So here are some of the basics that we teach our teachers in terms of what is a feeling, what is emotion, and how might we be able to shift feelings and emotions in the classroom using exercise snacks. So just as a brief overview, I know that this is Psychology 101 for some of you all, but just so that we're all on the same page, a feeling, let's define feelings. We know it's a subjective, self-contained experience. And that feeling can have different dimensions. It can have dimensions of pleasantness and it can have dimensions of arousal. We can feel very pleasant in an emotion and an experience, or we can feel unpleasant. We can have a high arousal experience and we can have a low arousal experience. And there are different emotions on the different degrees of that circumplex. So, for example, I'm at the University of Michigan on football Saturdays when we play Ohio State. That can be a very positive or negative, pleasant or unpleasant experience for us if we win or lose. The level of arousal will be different if I'm searching the scores on my ESPN app on my phone versus if I'm actually watching the game on TV versus if I'm in the big house. So you can see the difference. If we win, it'll be a pleasant experience. If I'm in the big house, it'll be a super aroused, pleasant experience. If we lose, and I'm at home, then it might be a moderately arousing but very unpleasant experience. Our children, us adults, we have these experiences all the time. So here you can see an emotional state is where do we fit in these different quadrants. This is a nice pragmatic tool that was developed by Yale Center for Emotional Intelligence that shows the difference between arousal or energy and pleasantness. And you yourself is somewhere in these four different quadrants as you're sitting there listening. So again, if we look at these quadrants, you can put little labels on them in terms of low pleasantness, high arousal, low pleasantness, low arousal, high pleasantness, low arousal, high pleasantness, high arousal. And in each one of these boxes, they have more specific emotions. So pop quiz, you can ask yourself, if you are a teacher teaching 20, 30 students in a classroom, what type of emotions or what type of pleasantness and arousal do you want your students to be experiencing when they're in that classroom? You can even ask yourself the question, what types of emotions are you experiencing right now? Now, this might depend on a whole host of conditions. Maybe you didn't get a good night's sleep, so you might be in the blue zone. Maybe you're super excited for that last talk, and so you're in the yellow zone because you're writing down all the different research ideas. Well, we hope that you are in the green-yellow zone. That's more of the focus, attentive, you're calm, you're feeling good. Green-yellow zone right there in the middle is where most teachers want their students. So, to answer this question, how do we then use exercise snacks to then get kids into that green-yellow zone where they're focused, calm, and attentive? Well, here's an example of what an exercise snack looks like in a classroom. We train teachers on getting students up, moving in the classroom. This is more military style where everybody is doing the exact same thing, following an exercise video. You're going to see some strength training in a minute. We pumped it up to do a little high intensity exercise, but you can see everyone is exercising. This is just for 3 or 4 minutes. In a minute, they're going to transition into doing squats or using their own body weight for strength training. And it's a great way to just interrupt some of that sitting that they're doing, learning that they're doing to engage in an activity break. And when we have done this in classes across the state, this is the response from teachers. What difference, if any, have exercise snacks made in your classroom? This is qualitative data collected from elementary school teachers, and they said 95% of the teachers responded positively in terms of improvements in focus and attention, it being a productive outlet for energy. And 82% of teachers have said that they see fewer behavioral issues and improved student self-regulation. When we went into schools and did direct observation, we were able to see after 3-minute exercise snacks, 99% of children were back on task within 30 seconds of doing an exercise snack. So enhanced focus and attention. And then after 4-minute exercise snacks, Heidi Roy Borland, she reported from her school, compared to the previous year, they saw a 34% reduction in behavioral referrals to the principal's office. So we do have evidence from the field in play when kids are engaging in exercise snacks throughout the day. This improves their focus, their attention, their self-regulation, and less students are being taken out of the class to go to the principal's office, which means it's going to enhance learning and behavioral outcomes. So, do we have evidence to suggest that our kindergarten classrooms can now turn into a nice, calm, and focused and enjoyable classroom? Yes, we do. And so we've been working on that for the last 5 or 6 years to disseminate strategies to teachers, schools, and to communities in the form of trainings to help teachers understand what are the benefits of exercise snacks, how can they help with emotion regulation and mood, and packaged it in a whole different series of trainings. 2018, we developed a teacher training modules. They're now freely available on Michigan Virtual, which is a virtual platform. Teachers can now get 8 continuing education credits for doing training on how do you integrate exercise snacks into the classroom. We've also developed a school leader training for PE teachers and principals to understand what are the benefits of exercise snacks and how can they help improve the cohesion, social cohesion within the school. We've integrated exercise snacks into the state health curriculum. So instead of just sitting there talking about physical activity, let's actually engage in physical activity while we're learning about physical activity. We've have a lot of partners across the state that have helped us to widely disseminate our programming, and we even have started international partnerships in places like Brazil, Mexico, and even the country of Vietnam is using some of our resources to integrate exercise snacks and make it more enjoyable for students all across the globe. Well, that's great in terms of understanding how we can use physical activity snacks in the classroom, but what about the home? Because again, we're 5 years out of the pandemic and we remember back to those days when the bedroom became the classroom. So is there a space for exercise snacks in the bedroom? The answer is yes. How did we do this? We promoted physical activity by putting it on TV. So during the 2020 pandemic, we were able to get COVID CARES funding to where we partnered with public television. And if you can channel your inner Richard Simmons, Jane Fonda, we put little exercise videos on TV for kids. You might ask, why did we choose television? Well, unfortunately, many of our students in the state of Michigan, approximately a third of our students, did not have internet access at home. So even if we had free and accessible resources available on the website, many of our students couldn't access it. So we partnered with Detroit Public Television and recruited a whole slew of PE teachers from across the state to develop these videos, put them on TV, and still to this day, we have approximately 20,000 viewers every single day watching exercise snacks on TV. We've done some research in the lab to make sure that kids are actually exercising, because just because you put physical activity on TV doesn't mean people actually get out of their chairs and do it. But if you give kids a calendar of different activities they should do, they will actually do it with parent support. So this was a great way for us to help promote physical activity. And here's an example. This is a 1-minute video. And again, most of the videos are 6 minutes exercise snacks, but this is more of like a commercial break video that's 1 minute of doing fast feet. On our website, we have tell folks what the intensity of the exercise is. This is more of a cardio video. And so we can do this right now. So you can stay in your seat. I'm going to do it standing, but let's do 1 minute of fast feet. This is basically, good. Yeah, if you want to stand, go for it. If you don't, you can do it in your chair. It's super fun in your chair too. So if we just do 1 minute, and I'm going to start and go. Let's just run in place. You can do it at different intensities. And while we're doing this, I see a whole bunch of smiles. So I've already proved my point that this influences your emotions. But if you're sitting, you can just run in place by moving your arms. You can do some sitting. Good job. Okay, we're halfway done. You can speed it up or you can slow it down. Choose your own adventure. This is your own movement journey. Good job. Good job. Nice work. Keep it up. You can encourage the person next to you. Feel free to run around. Give a high five. Awesome. Good job. Oh, I see some really fun running in the front here. Good job. Good job. Nice work. 5 seconds. Finishing strong. And you're done. Good job. Nice work. So now that you have engaged in an exercise snack, I want you to look at the board. How are you feeling? Where are you on that mood meter? Is your energy higher? Are you feeling more pleasant? Excellent. Well, I know some of you might be thinking, well, Rebecca, I have some kids in my class and they're naturally in the yellow zone. They really don't need an exercise break to get them more energized. If you're feeling that way, that's very true. Many of our teachers do say that. And so I would introduce you to my new friend, Kathy, who will give you a nice mindful break, breathing break. And this is what we teach in our classrooms. So we actually train teachers on how to do mindful moments, doing box breathing to help, again, activate that parasympathetic nervous system. You can pair that with an exercise snack and do breathing afterwards, but it's a great way to help get kids recentered, refocused. We like to say, push that reset button. And you can do this at home too. So what did we do? We tested these exercise videos. These were 6-minute exercise videos. We developed cardio videos, strength videos, mindfulness videos, and sports skills videos. We recruited 39 children. They did all 4 of these videos. We created over 132 videos, but we only asked them to do 4 random videos and just asked them, how did they feel? What was their experience in their affective experience, and asked them to answer a series of questions. We did this both in the home and in the laboratory. These are the findings from the laboratory. So they came in for an entire day, 8 a.m. until around, I guess it was half a day, until around lunchtime. They did 5 different videos, randomized the videos, and we asked them, gave them the feeling scale. So this measured pleasantness, arousal. We also measured rating of perceived exertion, and then they had a snack break in between. And so about 40 kids came into the lab, did each one of these. We also measured energy expenditure. So here's a picture of a student watching the video in the lab wearing energy expenditure equipment. They burned approximately 22 calories per video. That might not mean much to this audience, but it's important in terms of, as we're also talking about physical health outcomes, that this is a health-enhancing dose of exercise that can help students with weight management over time if they do a series of the videos. In terms of mood, they were on 3.5 out of 5. So that means they felt good during exercise. Ratings of perceived exertion were fairly light. So this was not a high, heavy intensity exercise. And you can see as we measured arousal and pleasantness during the activity, it might be hard for you to see from where you're sitting, but all of the different types of videos, the kids started somewhere, but they all moved into that green, yellow energy box. If we overlay the inner green and yellow over the data, you can see that the arrow points to where they started, to where they begin, and most of them during exercise are in that yellow and green zone, which is great. We also asked them at home. So we gave a different set of kids, 68 kids, all the way, not just elementary, but all the way up to high school. Ask them in 1 or 2 words after you finish the video, describe how participating in physical activity makes you feel. And in general, you can see that, again, they were in that yellow and green zone. Over the majority of the students reported that it was positive. They felt energized. They felt happy, just as how you felt. Some were negative, but this is to be expected. They were in the blue zone. They felt tired or sore. And that usually does happen with exercise, especially if you're engaging in exercise for the first time, especially if you're engaging in something like strength training or cardio for the first time. And then there were some that had both a positive and negative. It was fun, but I feel a little sore. It was beneficial, but I feel a little sore. It was fun, it was tiring, and that's okay too. It is important to note that about 5% really didn't feel anything. So you won't always induce an affective response with exercise. Some kids might need a larger dose. Some kids might need a smaller dose. So this can help us to fine tune. But overall, we see these positive affective responses in real world settings as kids are engaging in physical activity or exercise snacks. One other study, a former PhD student in my laboratory, Penelope, was really interested in understanding how does it affect mood in the real world. So just looking at observational data, putting an accelerometer on kids as they are engaging in 4-minute exercise snacks, 6-minute exercise snacks out in the home, in the school, in the playground. Is this influencing mood? And is it influencing it in a positive or negative way? And what she found just quickly is that yes, exercise snacks, whether they were 4 minutes or 6 minutes throughout the day, were associated with lower levels of unpleasant emotions. So we see positive influences on positive affect and a decrease of negative affect, both in real world settings, in the laboratory, in the classroom, in the bedroom. So again, exercise snacks are a win-win for our kids. So not only thinking about the classroom, but thinking about the home environment. Can we turn a dysregulated or shift a dysregulated household to a more regulated household? I believe we can with exercise snacks. And so how have we been doing that? I showed you at the beginning. We've created videos to help support exercise snacks in the home. We've also developed a family engagement toolkit. The publication is coming out next week, to where we align physical activity with all the different varying needs of children. During the pandemic, we were really excited to get kids moving more, but parents would come to us and say, yeah, but my kid, they're not sleeping. So, or they're not eating, their nutrition is off, or they need more grit or resilience, or they're feeling very lonely. All of these different emotions, all of these different behaviors, all of these different concerns of parents, we wanted to address, and we knew we could with physical activity. So this curriculum aligns physical activity with Maslow's hierarchy of needs, understanding that physical activity can help support physiological needs, safety needs, love and belonging needs, esteem needs, and self-actualization. And so we have, in 2025, just a few months ago, we have started these family engagement workshops that are free that families can call into, and just we walk them through each one of these different modules. We've also invented play cards, and these are a hit with my 3-year-old nephew that we will be testing soon. These play cards they're like Uno cards. And so you just play them instead of just looking at different numbers. You do a different activity, you earn a point, and it's a great family game. My favorite memories of our last Thanksgiving was my nephew busting into my room saying, Becky, can we play with the cards? And I was like, yes, we can. So these are great ways to engage in exercise snacks at home. We did recognize that we had one blind spot in one of our programs, that some of our videos were too high skill for neurodivergent children. As you know, that many of them may need additional instruction for videos or to engage in these videos, particularly at home. And so we went back to public television and created a whole series of starter videos that really work for anyone, kids that have low motor skills and neurodivergent skills, in teaching them how to do a jumping jack. So these are 2-minute exercise snacks, how to do jumping jacks, how to even do a burpee, but slowly over a course. There's 24 videos that are freely available on our website. And we are also creating a new set of play cards called a home starter kit to kind of get kids started exercising at home, and then they can transition to the play cards that are more advanced in the different skill level. So this is how we're promoting physical activity or exercise snacks in the home. So I just want to take a moment to thank all of the students. This is, while I get to do all the public speaking, they do all the hard lifting and the hard work behind creating a lot of these tools, going into the classrooms, understanding what teachers need, what parents need, going to the literature to understand what is a feasible strategy. Then we deploy the strategy out to the community, get the feedback, and continue to iterate over time. We also want to thank our funders who allow us to answer these different types of questions to again promote physical activity. It is our dream that exercise snacks will be implemented in every school, every home, every community, so that all kids can get 60 minutes of physical activity every day. And we love to partner with folks like you to make that happen. Thank you. So we have about 5 minutes if you have any questions. If you're feeling inspired to do another activity break, I got one up my sleeve. Question. Great question. So the question is, how often do the teachers do exercise snacks in the classroom? Our goal is to provide 20 minutes of exercise snacks throughout the day. So we encourage teachers to do 5 4-minute exercise snacks. We give them schedules, mock template schedules that they can use. We also give them a ramp up protocol to where you just start with one exercise snacks. Then once you get the procedures down for that, do two. When you feel comfortable with that, build it up to 3, 4, and 5. And most of the literature says that 20 minutes is probably the max that you can get because the number one barrier for teachers is time. Second highest barrier is classroom management. So you all are great, wonderful adults. And so once we finish the activity break, you sat right down. You can imagine in a classroom that may not happen. So we've helped them develop strategies, acronyms such as MOVE. It's time for materials down, open spaces, voices quiet, ears listening. And then once you finish, it's time for focus. Breathing activities, box breathing right after an activity break is a great way to calm the kids down and get them back on task. Or for the exercise physiologist in the room, taking their heart rate, make sure they're in the right heart rate zone. Because we know from the literature, if they're exercising at too high of an intensity, they'll be fatigued afterwards. And you'll move them into the moderate, pleasant, low arousal, sleepy zone. And we want to have them in that they're somewhat moderately aroused, feeling very pleasant in order for them to be in that focus zone. So teachers have really loved that we've given them the science of emotions. And it's not just, oh, Johnny's being bad today. No, he's highly aroused and he's feeling unpleasant. So how do we use movement to bring down his arousal and help him to feel more pleasant so that he can learn? And that's been a great way, instead of labeling kids, understanding what's going on. Well, yes, go for it. That's a great question. So teachers are hard to sell, as you might imagine. So we in our trainings, we tell teachers, hey, if you do these breaks, you will get 20 minutes out of 30 minutes. Like adults only have to get 30 minutes. So you'll get 2/3. You can consider this a workplace wellness activity. And so some take that to heart. Your PE teachers, your teachers who have a physical activity background, they're all in it to win it. Other teachers, they will do more like encouragement in the classroom, but we're still working on how do we pitch this as a workplace wellness program to it's not just for students, but it's for the entire classroom. We do know from the child perspective, even if the teacher's not engaging in the exercise, if they are cheering and encouraging, they actually have the highest participation rates in the students. So they don't necessarily have to, but we want them to for health and well-being purposes. But there is that somewhat embarrassment. Are the kids going to make fun of me? So we have to overcome those barriers too. Great question, though. Last question. Oh, last two questions. Oh, yeah. Yes. Absolutely. Thank you. It really comes from the field of implementation science. I can talk to folks afterwards if you're not familiar with that field, but they really focus on rapid response. Like most of our programs, particularly when you think about vaping, vaping came up in the substance prevention field. Vaping came up and it took us by storm, and the systems couldn't pivot to adjust the vaping concerns. And so there's a whole line of research like how do you rapidly adapt to the evolving world to meet people's needs. And I think the second piece is always listening. We always have boots on the ground listening to what teachers, what their needs are, not coming in like cardiometabolic health. And they're like, Johnny needs to sit down. Like you can see the disconnect there. Last point. Teacher support two ways. One, it's usually at the school level. So you need to have administrative support to say this is going to be a school-wide initiative. So we will have principals reach out to us. We've also learned that I can talk to you a little bit later. They can't just say, come in, do a professional development, and then walk away and never support the teachers again. We have to also train the principals and the school leaders on how do we adopt a new program and implement it with fidelity. We've also partnered with Blue Cross Blue Shield. So in 2024, we started partnering with Blue Cross Blue Shield. They have what's called Healthy Communities Program. And so our program is listed in there. And so schools can apply to get coaching. And so they already have a school health team in place. And so we just provide the resources and the training to support schools as they're integrating exercise snacks. That took a little time, but yes, you definitely want not just one teacher. We always give free resources to any teacher that wants it, but they will feel siloed and alone if they try to implement by themselves. So we try to have school-based implementation. Thank you so much. And I'm happy to answer any questions at lunch.